Rhino cerebral mucormycosis, also known as zygomycosis, is a rare disease caused by the filamentous fungi that affects the nose, paranasal sinuses, and brain. Filamentous fungi are opportunistic pathogens that frequently infect individuals with weakened immune system, like uncontrolled diabetes, HIV, coronavirus, or patients on the immunosuppressant drugs. They belong to the saprophytic fungi. Phycomycetes is the class, order Mucorales. These fungal infections they initiate in the nasal cavity and subsequently spread to the adjacent paranasal sinuses, where they proliferate. Rapid progression of the mucormycosis is due to its unique angio-invasive pathogenesis. Fungal hyphae invading the blood vessels damage the endothelium and cause the blood clots that obstruct the blood vessels and ultimately lead to ischemia and necrosis of the adjacent tissue, which acts as nidus for the further spread. Clinical signs initially may be non-specific with the pain, however proptosis, and there may be one-sided headache behind the eyes, lethargy, fever, epistaxis. There may see the black discoloration of the inferior turbinate. However, further spread can lead to the altered sensorium, seizures, and multiple cranial palsy. For diagnosis, confirmation is by the histopathological confirmation. CT scan is usually used to show the extent of the disease and the bony erosions. MRI may have a role. Treatment is drug of choice is the liposomal amphotericin B. Warfarin may have to be used. Surgical removal of that mass may be needed. Rifampicin, hyperbaric oxygen therapy, and antifungal agents like the azoles may have some role. Recently, in the Neurology India, in the April 2025 issue, Dr. Rajaram Sharma from Udaipur has reported about the 95 patients of this Rhino orbital cerebral mucormycosis in the COVID infection. They have commented on the imaging characteristics. They noted that post-gadolinium T1 weighted imaging with fat suppression best delineates the structure's viability and the pattern of extension of infection. The classic black turbinate sign was present only in the 10% of these patients. There was association with the bone erosion and destructive bone patterns were also common. Now this mucormycosis, as it has the angioinvasive nature, can result in the vascular thrombosis. These lesions they appear isointense or hypointense in all MRI sequences. Lesions demonstrate variable enhancement pattern. T1 weighted contrast enhanced image help delineate the extent of the disease spread. T2 weighted hypointense appearance may be due to the presence of iron and manganese in the fungal elements. It is not considered a reliable marker due to the variability of the T2 signals and enhancement. They say that MRI may prove superior to CT in diagnosing the mucormycosis.